Bien, bonjour à tous. Donc, je vais modérer la première partie de cette journée sur l'épidémiologie et la clinique. Donc, on a plusieurs intervenants. On a déjà pris un peu de retard, mais je pense que c'est absorbable sur la pause de midi encore. Et donc, je vais appeler le docteur LEHMANN, qui nous vient donc d'Allemagne, qui va nous présenter ses résultats et également les notions de définition et de prévalence. Alors, je vais me mettre là pour avoir accès au chat, parce qu'il va probablement y avoir des questions, pour essayer de les sélectionner en même temps que donc les gens qui sont en ligne, n'hésitez pas à poser des questions. Et puis, on va essayer de les poser ensuite si on a un peu de temps. Alors, ça va vraiment être frustrant, hein, je vous le dis à tous, parce qu'on a très peu de temps. Les modérateurs vont avoir le mauvais rôle, qui va être de mettre fin au débat qui risque d'être riche. Merci.
Très bien, donc je suis très heureuse d'être ici. Donc, mon nom est Clara LEHMANN, je suis médecin infectiologue en Allemagne, à l'Université de Cologne. Je commence en français, mais je vais continuer en anglais parce que ce sont les mots techniques qui sont plus faciles pour moi. Donc, je continue en anglais. So, first of all, I would like to give you a case definition of long COVID. For several months, we didn't really know, and there was a high discussion about the definition, and we now have from the WHO a definition, a clinical case definition of post-COVID syndrome. So, the case definition is as following: ongoing symptomatic COVID-19, signs and symptoms of COVID-19 from 4 weeks up to 12 weeks, and the post-COVID syndrome is defined as having new signs and symptoms that develop during or after an infection consistent with COVID-19, continues for more than 12 weeks, and are not explained by an alternative diagnosis. Moreover, there's no clear biochemical or radiological feature that could explain the diagnosis, and so we think there are several phenotypes with different presentations, prognosis, and outcomes, and this is what we will discuss today. You know that, and we will also have some presentation about this. Different organs are affected, so the lung, the heart, also the brain fog, the nerves with neuropathies, but also the kidneys and also the gastrointestinal tract. In Cologne, we have started very early with a big study after the first wave of COVID, and so we have discussed what kind of prevalence we think we have about the post-COVID syndrome. And it's extremely difficult because if you look in the literature, the studies are really different and they are not comparable. So, for example, the definition of the patients are different. We have hospitalized patients, non-hospital, or mostly hospitalized patients. Also, the time is different between the studies. So we have below 1 month or more than 6 months. Also, a high bias of the studies, the recruitment, the participants, but also the symptoms are really different between the studies. And finally, also the number of the participants between the studies. So here you can see the summary, why it's so difficult to really identify the prevalence. And this is a publication which was just published a few weeks ago, and they included different studies, which is here summarized, and they tried to analyze the prevalence in the different studies, and what you can see here from the summary that we think it's a prevalence of post-COVID syndrome between 10 and 30%. So we are not sure yet, and we have to work on that to identify the real prevalence. As I just mentioned, in Cologne at the University Hospital, and from where I work, we have a big post-COVID cohort, which we started very early after the first wave, and we have about 1,000 patients we follow every 3 months. The patients in our cohorts are very young, about 43 years old, and almost no preconditions, no medical preconditions. Moreover, most of the study population, here you can see it, are women, and they are all outpatients. So they all had mild symptoms during the acute phase. And what we could see after 7 months is the following symptoms. First of all, more women were affected by symptoms, but also they had ageusia and anosmia, short of breath, and fatigue. And if we analyze the rate of the post-COVID syndrome in our cohort, we find something about between 12 and 25%, defining the different groups. So this corresponds also to the literature. The risk factors we identified for the post-COVID syndromes were diarrhea during the acute phase, anosmia, but also low IgG during or just after the acute infection. Because we could find that the patients with low IgG, they had more often symptoms after 7 months. So if I summarize, there's a clear case definition of the WHO from October now. The prevalence is not really comparable between the studies. It must be something between 15 and 45%. In our study, we could observe the following symptoms: the shortness of breath, fatigue, smell, and taste changes. Even after 7 months, up to 15 to 25% had a post-COVID syndrome, and the risk factors were low IgG, diarrhea, and anosmia during the acute phase of the infection. Merci beaucoup pour votre attention et je suis prête pour des questions.
Merci. On les posera à la fin des trois sessions.
D'accord, on attend les 3 autres. Okay.
Comme ça, on parle après quand on a vu l'ensemble. Alors, est-ce qu'on peut garder le diaporama visible plutôt que ça change avec le visage des